This time I'm gonna be talking about a unique case report which was published in March in 2018 for a Chinese patient, and her case was as follows. A 39-year-old woman presented with fever, and after the fever had persisted for 3 days, she began using antipyretics, but her temperature continued to increase, reaching 40.3 degrees Celsius. Her medical history included allergy to penicillin, abortions, which were done twice. She had a C-section. She had been taking contraceptive drugs for 1.5 years with no previous family history for genetic or autoimmune diseases. So, since the age of 36 years, she had experienced dry eyes, oral dryness with difficulties in swallowing and speaking, plus taste changes, but had felt that the symptoms were tolerable. So she started using eye drops to relieve her dry eyes. Lymph node enlargement was found. Then a very long list of laboratory tests was done for the patient, and the most important or most significant points to be mentioned about those tests were the following: elevated levels of C-reactive protein, negative results for HIV, hepatitis B and C viruses, positive results for herpes simplex viruses 1 and 2 immunoglobulin G, and elevated levels of erythrocyte sedimentation rate and rheumatoid factor. After the patient was hospitalized, on the first day she received IV antibiotics. On the second day, red papules appeared over her entire body and she reported slightly blurred vision. On the fourth day, multiple painful ulcers surrounding the lingual frenum rapidly appeared. Papular lesions spread over her body and were particularly prominent on her abdomen and legs. Her temperature continued to increase and no improvement was observed. Histological features included a positive biopsy of minor salivary gland having chronic inflammatory cells. A Schirmer paper strip tear test was positive with bilateral retinal scattered lesions. For those who don't know, Schirmer's test is done to know if the lacrimal gland produces enough tears to keep the eye moisturized. It is used when the patient experiences very dry eyes. So the result of the test is normal when more than 10 millimeters of moisture is present on the filter paper over a period of 5 minutes, as shown in this photograph. After that, what is the diagnosis? Given these results, the patient was diagnosed with Behçet's disease per the criteria of the International Study Group for Behçet's disease. She was also diagnosed with Sjögren syndrome, based on the criteria of the European Study Group on classification criteria for Sjögren syndrome. On day number 6 after hospitalization, they changed her treatment to IV methylprednisolone along with antibiotics. The patient's condition improved markedly and she was discharged from the hospital. And later on, she continued her treatment with oral glucocorticoids for 1 week. Papules have faded, as well as the blurred vision and the retinal lesions. As seen here, Sjögren syndrome main oral manifestations include swelling of the salivary glands, oral infections, mainly candida infections, as seen in this photograph, and oral dryness. Systemic manifestations include papular lesions as seen on the left side and arthritis with joint deformities as seen on the right side. While for Behçet's disease, it includes oral ulcers, inflammation of the eyes, vasculitis and retinitis in some patients, with painful and swollen stiff joints. Now, as shown in this photograph, this is the pathology test. It is a very important diagnostic test done if we are suspecting that the patient is having Behçet's disease. So for this case, it was not really easy to have a diagnosis, and no single investigation can reliably establish such a diagnosis. So tests for Sjögren's syndrome in general include anti-nuclear antibodies, salivary flow rates, salivary gland biopsy, and Schirmer test. While for Behçet's disease, we mainly depend on clinical examination, and we mentioned the pathology test, and we can do blood tests to rule out other diseases. So to conclude, Behçet's disease combined with Sjögren's syndrome is considered rare. To the best of our knowledge, this is the first Chinese patient in whom both conditions have been reported. Additionally, among the cases of combined Behçet's disease and Sjögren's syndrome reported to date, the current case is the first in which the primary initial symptom of Behçet's disease was fever. Because as we know, fever is not a symptom that is usually seen in patients of Behçet's disease. Another important issue mentioned in this case report was that herpes simplex virus may have an association with Behçet's disease, since herpes simplex virus type 1 antibodies were reportedly found in a higher proportion of patients with Behçet's disease than in controls. But still, further research and investigations are needed in that regard. And thank you.